So what are we going to look at? We're looking at treatment planning, digital diagnosis, capturing patient data, dental materials, computer-aided design, and finally computer-aided manufacturing. Let's start with examination diagnosis. Here's the treatment sequence as we go through an implant therapy. And we'll start with what we just alluded to: interview, clinical examination, impression, and then we'll do an initial treatment plan and diagnostic setup. So for a number of years, we've taken these scans, we've avoided taking impressions the conventional way, and all the patients that come in our department, they receive a digital scan. When you have some routine, they're easy to work with. Then we do a diagnostic setup, and let's look at a patient. I know it's a pretty complex situation, it's not an everyday case, but we need to make a treatment plan and mimic together with the patient the final outcome we're looking for as the end of treatment. So we have a direct digital wax up. Usually we have a software where the software already makes some suggestions. Not necessarily in this case, because the computer doesn't know what the real teeth would look like. And then the dental technician can make alterations with very little effort. And these different designs, information is sent to digital printer, and the digital printer will print mock-ups. The next step is that we try these mock-ups in on our patient. So here you see 3 different mock-ups. Generally speaking, in the posterior, they're all the same, but aesthetically, they look different. You see the top one, look at the incisal edges and compare it to the bottom one, or the lateral incisors at the top to the middle one.